and welcome to the latest edition of Dermatology 101, Dottie's Transformation. Hi, I'm Dr. Karla Cunningham, and this is Dottie. And if you've been following our series, it's been a little while since you've seen her last, but look at her now. We'll put a big picture up here of what she looked like when we got her on August 30th, but today is February 2nd. And she has grown her hair back and she's doing great, but she does have an ear infection. And I think it happened because we gave her a bath and I didn't remember to put the ear wash that I normally put in her ears, and I think water got in there and set her up an ear infection because she hasn't had a problem since we got her. But ear infections, or otitis externa, is very, very common in dogs. We see it and diagnose it almost every day in practice. So if your dog has an ear infection or is shaking its head or scratching in its ears, don't be alarmed. We see it all the time and we can treat it. But I wanted to go over that with you today. Now, one of the main differences between ear infections in people, especially kids, and ear infections in dogs, that in people, it's otitis media, which means it's in the middle part of the ear, and in dogs it's otitis externa, which is the outer part of the ear, and the difference is where the eardrum is, or the tympanic membrane. So in dogs, they have this really long canal, and in humans they have a very short canal, and it's just this horizontal part, but dogs have this big vertical canal and then this horizontal canal, and the lining of this is just specialized skin. So a lot of times dogs that have skin infections or skin problems also have ear problems. And sometimes dogs that have one ear infection will get them over and over because it is related to allergies. So Dottie has an ear infection. We knew that she had something going on because her ear was, the inside of her ear, right here, was really, really red. And she was painful. When I went to rub her ears like that, she'd cry, and it felt warm. So if you're noticing anything like that when you pet your dog and the ear, she cries, or that it feels hot, or it feels like there's secretions or crust coming out of it, call the vet. We need to get her in. So what happens when we see a dog with an ear infection? We use an otoscope to look in the ear. Then we'll take a swab of the lining of the ear and put that on a microscope. We'll look at that under the, we'll put that on a microscope slide, and then we'll look at it under the microscope. And what we're looking for is yeast and round or cocci shaped bacteria or rod shaped bacteria. And most of the time it's going to be cocci and yeast, one or the other or both, and we would pick the medicine that we're going to put in the ear based on what we find. Now sometimes we find rod-shaped bacteria, and those are usually a little bit harder infections to get rid of. So depending on what we find in the ear, we pick the best medicine. But ear infections in dogs almost always have to be treated topically, which means we don't give them antibiotics by mouth. We want to give them antibiotics and something for yeast or an antifungal in the ear. So with Dottie's case, she did have some rod-shaped bacteria, so we picked this medicine called Mometavet, which works really well. And I'm gonna see, it's got this long nozzle on it. I'm just gonna pick up her ear and put that right down in there. Now I'm gonna put this all the way down in her ear, and I'm gonna give it a little squeeze. Now I can't count how many drops that we're putting in there because I can't see it, right? So we want to put enough medicine in there that we can hear it kind of sloshing around in there as we rub it. We're going to do that on both ears, and we do it twice a day, and we do it for 2 weeks. And the main reason that ear treatments fail is because, one, we don't use enough medicine, so we really want to get a good squirt in there and be able to hear it sloshing around. 2, we don't do it often enough, so if we can get it twice a day, almost, maybe you don't get it twice a day every day, because sometimes that you just forget or something comes up, but 90% of the time while we're treating her. So we use enough medicine often enough, long enough for that full 2 weeks. And then the fourth reason that a lot of times ear treatments fail is because you don't come back for your recheck that we schedule you for. The rechecks are really, really important because sometimes they'll get better and you think that they're fine, but when we look inside the ear, there's still inflammation, there's still debris, there's still some pain, but it's subclinical. It just kind of sits there and cooks along, and the next thing you know, you got an ear infection again, and maybe this time they're more resistant to our treatment plan. So the rechecks are really, really important. Sometimes dogs get an ear infection and maybe it's only once every 2 or 3 years, and in which case we just deal with it as it comes along. But some dogs, it's like, okay, we got them cleared up from this ear infection, we rechecked, everything was fine, and then 2 or 3 months later, they're scratching their ears again. When we see dogs like that, we really worry that there is an allergy. We want to get to the bottom of that. And then we may also prescribe a maintenance treatment, which might be something called Zymox. It may be ear washes. In Dottie's case, because she had that rod-shaped bacteria, there's an ear wash called Triz EDTA that works really good on those. So your veterinarian is going to be really important in helping you figure out how to treat that chronic recurring ear infection that your dog may get. But luckily Dottie is responding well, and I'm going to have to remember to use that ear wash before her next bath. That's all for today. We hope you enjoyed it and learned something, and we'll catch you next time. Bye.